Hello everyone, welcome to sqadia.com. I'm Dr. Hina Khan, and today the topic of our discussion is the somatoform disorders. So when we basically give you the terminology of the somatoform disorder, you have a patient at your hand who is suffering from a somatoform disorder. The disorder is basically of the psychiatric origin, and basically the person is giving you all of the physical signs and symptoms of a genuine illness that he or she may be suffering from. So sometimes it's usually quite confusing to differentiate between a genuine illness and a somatoform disorder. So over here in this lecture, we'll be focusing in the very first section on the hypochondriasis, which is basically an unnecessary and an unexplained fear of suffering from a very severe illness. For example, it can be HIV, it can be cancer, or suffering from some sort of a tumor. So all of these are basically categorized as the hypochondriacal disorders. So this is basically the first section that we'll be focusing on, and moreover we'll be detailing the clinical presentations of the hypochondriacal disorders over here in this very first section. Moving on, we'll be discussing the causative factors that are going to make the person more prone to the development of the hypochondriacal disorders. Then some of the management tips that are of the general kind. For example, it can be the exercising or the avoidance of the alcohol that can improve the general thought form or the thought content of the individual, and that are basically the stress releasing tips that can make the individual less prone to the development of this sort of a disease or the development of the somatoform disorders. In the second section, we'll be focusing on the differential diagnosis. So when you have a patient of somatoform disorders, there are different diagnoses. For example, it can be the factitious Munchausen syndrome in a lot of individuals. We can have hypochondriacal disorders, the dissociative conversion disorders. All of these are seen in a lot of individuals. So the treatment guidelines for these differentials will be discussed over here. And then we are going to know the differentiation of the clinical presentation of all of these disorders. What are the particular signs and symptoms? Even on a clinical basis, you can differentiate between these different forms of the somatoform disorders. So that is what we're going to do over here in this very second section. Moving on to the third section, we'll be discussing the conversion disorders over here. What is the DSM-4 categorization of such disorders? And then the epidemiology, that is basically the prevalence and the occurrence of such sort of conversion disorders. That will be discussed over here in this very third section. And we will be also dealing or discussing the phenomenology of the conversion disorders over here in this very third section. In the fourth section, we'll be summarizing the workup. So workup is basically the management or the treatment guidelines that are to be taken by the practicing psychiatrist or the clinician when he has that somatoform disorders in his or her clinic. The diagnosis, the differentials that he has at his or her hand, and then how is he going to make the further final diagnosis of that patient is very important. Then from the different range of the treatment modalities that are available, ranging from the supportive care, then we have the medications that are available, and that basically includes the antidepressants, the anxiolytics that are sometimes given to relieve the anxiety in these patients. And sometimes the supportive therapy along with the medications is coupled up with the cognitive behavioral therapies. So all of these are going to be discussed over here in this very fourth section. Then we're going to move on to the confusing elements. Sometimes it's very confusing to differentiate between a particular somatoform disorder and a genuine illness in these patients. So one should know how to differentiate between these two, and that we'll be discussing over here in this very fourth section. In the fifth and the final section, we'll be discussing the psychopathologies over here. So the psychopathology underlying these somatoform disorders, we'll be discussing that over here. What are the different approaches? It can be a diagnostic approach, and then we have the ranging approach in which we basically differentiate a mild from moderate and a severe variety of the somatoform disorders. What are the consequences when we differentiate these psychopathologies? Because the treatment guidelines basically depend upon the psychopathology or the underlying psychopathology of any ailment that the person is suffering from. The diagnostic approaches and the different sorts of the current diagnostic approaches are discussed over here in the fifth and the final section. So I hope you want to learn more about these somatoform disorders. So do watch the other sections to this lecture as well.